are back here on Healthy Living. Nurse Shelley, RN nurse. You do a lot of different things here at the hospital. You've joined us here. We are in the stress testing lab. I guess that's what we call it, isn't it?
Yes, it
and
is.
I'm really excited about this. Dr. Ford suggested that I might need a stress test. So now I'd kind of like to know if we're simulating this and someone comes in and needs a stress test, why would that be? And what is a stress test?
Okay, a stress test is a non-invasive way of checking your blood flow to the coronary arteries, both at rest and with exercise. And in your case, you sound like you're an outpatient. Mm-hmm. Have you had chest pain or shortness of breath?
Exactly, and so I think that's what they wanted to do that for.
Okay, those are great reasons why you need a nuclear stress test. And so as long as you have not had a heart attack in the last 2 days, a pulmonary embolism, or you have unstable angina. So you're coming here because you have history of chest pain.
Correct.
And we want to figure out why. So it looks like you're physically capable of getting on a treadmill.
Yes.
So we are going to exercise your heart naturally. So
are there different kinds? If I couldn't get on the treadmill, what would that look like?
That would be a chemical stress test, and so you would be getting LexiScan, and that is for people that can't walk, they have a bad knee, they're just older, and they can't get up on a treadmill. So we'll give them a chemical that will exercise their heart internally. We may have them get on the treadmill very slow just because it helps with some of the side effects, because the inside of your body is exercising, but the outside of your body is not exercising. So a lot of people will get a little nausea. They'll get shortness of breath, chest pain, like the rim is spinning, and so we may just have them go real slow, but we are really exercising their heart chemically. But you are going to be doing the treadmill.
So what can I expect? We're probably going to take a quick break while we kind of rig me up. What are you actually going to be doing?
Okay, I'm going to be putting you on a 12-lead cardiac monitor.
Okay.
I'll be checking your blood pressure, and I'll be checking your blood pressure before the test and during the test a few times and after the test.
Okay.
And then we'll get you on the treadmill, and based on your age, we have a target heart rate that we'd like to get to.
Okay.
And that's usually 85%. And we'd like you to get to the 85%, and then we want you to walk for at least another minute past that. And then after that, then when you come back here, we'll check your blood pressure, and then you go back for your second set of pictures. The first set of pictures is they're taking pictures of your heart when it's resting. They want to check the blood flow.
All right.
And then the second set of pictures is they want to check the blood flow to your heart when it's exercising. And then they compare the two. And sometimes, like if you've had open heart surgery or you've had a myocardial infarction, a heart attack, then there may be decreased blood flow to your imaging ahead of time.
Okay.
And then afterwards they can see what the result is. They can compare the two. You may have abnormal for both, and if you have abnormal for both, then they may send you to a cardiac cath and that's more of an invasive intervention.
So this is more of a diagnostic technique just to find out where I am.
Yes, and a lot of people will come get this test if they're having knee surgery or kind of like a pre-op to make sure that their heart is strong enough. Somebody that might have had open heart surgery or stents, this may just be an extra test just to see how those stents are doing. Yep, to make sure the blood flow is still going.
Well, let's do this. I'll let you kind of get me ready, and then we'll jump back on the treadmill so that you all can see what this is like. I tell you, I was really apprehensive coming in, and now I'm feeling much more comfortable already.
Well, I also think if you're going to have a complication, which is very rare here, I would rather you be in a controlled setting where we have a crash cart, you have a doctor, you have an RN, and we can take care of you rather than you on your own go to a fitness center and start working out and having chest pain, and then it may take a few minutes for EMS to get to you.
Oh, this is great. Thank you. All right, Shelley, we are back. What do you want me to do? You want to tell them what you did to me?
Okay. I have Debbie all hooked up to the 12-lead EKG, and there's 10 electrodes, but it's 12 different ways of looking at the heart, and we will be continuously monitoring her on the machine. And so prior to calling the doctor in, I'm going to get a blood pressure.
And while she's getting ready to do that, if I can say that, I really thought I was going to be in a gown and all of these things, and you were like, no, when you come in outpatient, you get orders what to wear, tennis shoes. I did not oblige and wear something comfortable because I had to do other TV shows. But basically, you gave me a lot of instructions.
Just something comfortable, tennis shoes, no flip-flops, because you may sweat if you're on the treadmill for a period of time. So, but I'm going to check her blood pressure. Some things I want to make sure that she did not have are no caffeine.
Okay, I did not have a caffeine.
For 24 hours, not even decaffeinated. Also, one thing that she should not have taken are any kind of medications that would lower your heart rate, like a beta blocker.
Did not.
Okay, and also we recommend that you bring those medications with you so that you can take them as soon as your test is over.
Okay.
So did you have any caffeine
I did not.
or beta blockers this morning?
No.
Excellent. All right, well, I'm going to get your blood pressure, and we're going to be checking the blood pressure before, during, and after the test.
And why do you do that?
The reason why we check a manual blood pressure is because, number one, it's the most accurate. We could do the machines, like when you go to the ER, when you have a blood pressure machine, they take too long. We want to make sure we're getting a blood pressure on the spot when we need it.
Got it.
Okay?
Got it.
All right.
So we do blood pressure, and then, I guess I have to be quiet for a second when we're doing a blood pressure. I know, Gustavo.
Is that hard
and
to do
Megan
for
are
you?
like, yes. Is that hard to do for you? A little bit.
All right. Let's do this one.
Dead air.
Excellent blood pressure, 110 over 64.
All right. Not bad for 66, old lady, 9 grandchildren.
No, and if the blood pressure is too high at this point, we may not do the test.
Okay,
Because we don't want to stress the heart too much.
Okay.
So,
Because I would imagine you're a little stressy right now because you kind of got all kinds of goodies on.
Yeah, and sometimes that happens, so I may wait 10 minutes and just kind of calm the patient down a little bit and then recheck it.
Oh, this is so helpful.
So what we do at this point, we'd get a consent sign to go over all the risk and for the test and the reason for the test, and then we would call one of the cardiologists in.
Okay.
And
Am
they
I
would
going
come
up?
in. Yes.
Okay.
And then we'd get the patient on the machine.
I like to know there's a big red button here.
And I need to do like the pre-test
Okay.
and the blood pressure.
I will say, just for simulation, sometimes it's fun to know the behind the scenes. I'm wearing Shelly's tennis shoes right now because I was not necessarily appropriately dressed. So we do whatever we can do.
That's right.
Exactly.
Happy to lend them to you.
Thank
And then prior to doing the test, I would also run a 12-lead EKG.
Is that what we're doing now?
That's what we're doing.
I don't feel
And we have a really good rhythm, as you can see.
It's really interesting. I'm trying to be a compliant patient here, but I have so many questions.
You're doing great. So then we're going to go ahead and start the treadmill.
Okay.
So I want you to hold on up here.
So do you recommend you hold on?
Just hold on lightly.
Okay.
And it's going to start off kind of slow.
So that people get their footing. How does this really work? How is it calibrated? Does it go up every
It's going to
minute
go
or
up every 3 minutes. It's
Okay.
going to go up in speed and up in the slope, your grade.
Okay.
And that's usually what gets people is going up in the grade.
The grade? Okay. Is there a typical time that you keep people on, or like you said, it's more to get your heart rate up?
Right here, Debbie's at 50%, 57% of her target heart rate, and that's based on age.
Okay.
Usually you take 220 minus their age, and we're trying to get her up to 85% for at least 1 minute.
Okay. Okay. I thought my target heart rate was like 135,
Well, you're
based on my age.
140
140
is what this machine is calculating, and we're trying to get 85%.
Oh, got it.
So-
Okay, got it. Now, are most of the people, are you questioning them when they're on the treadmill? Are
Usually
they-
you're just kind of assuring them like you're completely fine, you're doing great.
Okay.
Because there are some people that cannot stay on the treadmill and cannot get up to 85%. So we'll have to turn off the treadmill, and then we get them on the stretcher, and then we have to give them the chemical,
Okay.
which is the Lexi scan, and then we have to talk them through that.
So what are you looking for? I mean, are you monitoring as I'm going
Yep,
up?
I'm monitoring for any kind of arrhythmias. Some people have arrhythmias when they exercise. That is to be
Okay.
expected. Usually that will stop when they get off the treadmill. We're also looking for very dangerous arrhythmias like VTach, VFib.
Okay.
And that's when we would have to get the crash cart. But that is very rare, like 1 in 10,000.
And because we only have about a minute left, let's assume the fact that we've hit the maximum heart rate and we're winding down. I come off of the treadmill, and then what happens?
Then I help you over to the stretcher, and I usually give you some water, something to drink, check your blood pressure.
And then I'm good to go.
We want to make sure your blood pressure is pretty much close to the baseline where you started.
And then you're good to go? The doctor reads the results?
Well, the doctor will leave the room, but then you have to go for your second set of pictures, and that will measure your blood flow to your heart with the exercise. And then the doctor later on that night will read both pictures, the before and after.
I really appreciate you doing this, so stay tuned. I think we'll be back here to see some other things at another time. Thank you, Shelley. You were great.
You're welcome. Thank you so
Again, you've
much.
made this so easy. Thank you all for joining us.
pleasure.
I have to finish my stress test here on Healthy Living.
Thank you.